Okay, let's go back to this semi-solid drug. So suppositories, like I said, some examples is, medicines for constipation. So Tylenol can be given as a suppository, and a lot of anti-seizure medicines too. The thing about a seizure medicine, they're not going to be able to take it in the middle of a seizure.
Yeah.
So a suppository can be used as like an emergency type medicine. Ointments is usually like a really oily or greasy medication for external application. Usually you rub it into the skin. And that's different than a cream. A cream gets more absorbed, and an ointment is that oily kind of Vaseline kind of texture. Okay, cream, non-greasy preparations usually has a water base instead of an oil base. Okay, administered to the skin or via some kind of applicator, like an intravaginal cream. Jelly-like substance, or typically is a topical application. Lotions, usually relates to some kind of skin disorder. A paste, because it's topical, but it has a fatty base ingredient too. So we might apply it to one particular area. Wouldn't necessarily leave it on for a long period of time. And then patches, the method of delivery for some semi-solid dosage forms. Okay, so what's one patch we already talked about? Fentanyl patch or Dosages. Okay, so that's definitely an example. They also make clonidine patches. Clonidine is a blood pressure medicine. They make a lot of birth controls can come in patches. There's birth control patches, other hormone type patches like that too. So, okay, liquid drugs, we have syrups. High concentration of sugar in water, and then have whatever medicine that it's supposed to have. So a syrup is going to be kind of sugary. Okay, solution is just like a drug that's been dissolved into something, like it says normal saline. Okay, got sodium chloride dissolved in water. Spirits, these are alcohol containing. And sometimes you'll see these as elixirs too. Elixirs have alcohol in them. Whenever you see a question that talks about, an alcohol containing something, because I've seen this question before, it's an elixir versus a syrup. Okay. Tincture, alcoholic preparations of soluble drugs. They usually like you use them with a dropper. I don't see that very often anymore. Fluid extracts, plant sources. Liniment is a mixture of drugs with oil, soap, water, or alcohol. You don't see a lot of that anymore unless you're into like the natural remedies kind of stuff you might see. Mixtures and suspensions, agents mixed with a liquid but not dissolved. Okay, so like amoxicillin, or if y'all taken the pink bubble gum amoxicillin before, okay, that is a suspension. You know, taking that one.
It tastes good.
It's like bubble gum.
Yeah, you have to like shake it up.
But you have to shake it because otherwise all those particles kind of fall to the bottom, and then you won't get the right amount of medicine. A lot of times those come whenever they're actually supplied at the pharmacist in a bottle that has powder in it, and they mix it at the pharmacy. Word of advice, whenever you're mixing stuff like this, y'all will never remember this, but someday you'll learn about it on your own, because you'll do it wrong, and then you'll remember. But if you put water, if you don't shake up that medicine in that bottle before you put water in, it will, some of it gets caked in the bottom, and you never get it out. You can shake it as much as you want to, like that. Always shake it first and then add a little bit of water and then shake it again and then add the rest of it, or whatever you're mixing it with. It may not be water. Aromatic waters. Emulsion is something you will hear. Pharmaceutical preparations of two agents that are not ordinarily mixed, like oil and water. Creams. Most creams and lotions are emulsions, so a lot of times you want to shake these before you give them or mix them really good. We'll talk about emulsions a little more when we get on to compounding later on. One thing that's really important with liquid dosage forms, especially as a pharmacy tech, is that you give the person the right tool to measure the medicine appropriately. Okay, so like for my baby, I get medicine for him. If you give me a medicine cup, he can't drink from a medicine cup yet. He needs a syringe. So that's something to take note of. Always look at check their birthday and go from there. Gaseous drugs include anesthetics and compressed gases. Anesthetics, remember that's what we used to put somebody to sleep. Anesthetic is not without feeling. Okay, so drug administration, so determination factors. So things that are going to determine what, like some medicines can be given IM, so intramuscularly, like a shot into the muscle. They might can be given subcutaneously. What would that be? Under what? Cutaneous. What would it? Skin. Subcutaneous tissue is fatty tissue.
So we're gonna do that? Cut open your arm and put it up in there?
No, it's a needle. It's just a shorter needle.
Oh.
Okay, like insulin. Okay, insulin is a subcutaneous injection. Needle's really crooked, but see, that's not going to go into the muscle. It's not long enough. That's an example of subcutaneous. Anyway, so those things, depending on how fast they need the medicine, and that's also going to determine what route. Physical, emotional state of the patient. Hey, if they're not with it and they can't talk to you, if they're unconscious, obviously you can't give them oral medicine. Okay, they're just going to choke on it. And then the characteristics of the drug. Some drugs can only be given a certain way. Other factors include their age, disease and their condition, and then absorption, distribution, metabolism, elimination of the drug itself. So that can determine that too. Okay, oral route. Safest and most convenient. It makes sense. Presence or absence of food in the stomach can change the absorption rate. So some of these medicines, as we look at them, you know, they shouldn't be given with food, or maybe they should be given with food. Some of them can't be given with certain foods. Oral drugs are usually not used if they're nauseated or vomiting. Now, one example is Zofran, which is anti-emetic drug. It's for vomiting, it's for stomach upset, and it's like a sublingual, so it kind of melts under their tongue, which I kind of feel like would make me more nauseous. So, oral route, basic equipment needed, obviously, whatever you're going to put the medicine in. Medicine dropper and oral syringe, they look different. An oral syringe looks different than a syringe that you use with a needle. Okay, usually the tip of them, yeah, it's like they're not like, there's not threads around it. Okay, so that you can screw a needle onto there. Calibrated spoon, you know, one of those little medicine spoons that they get sometimes. Okay, sublingual, again, is under the tongue. So you want this whenever you need it to work really quickly. So it actually gets directly absorbed into the bloodstream under the tongue. So migraine medicines, angina, like nitro, I'm thinking of nitrostat, whatever. Anyways, it's an angina medicine that they take, usually little bitty pill, and then it just goes under their tongue and gets absorbed. And there's other ones too, but buccal means cheek, so you put it in your cheek, between your cheek and gum, so you let it absorb there. There's a dropper, medicine cup. This is an oral syringe. So it's kind of hard to see on here, but it's got a little tip on it instead of being like a, sublingual under the tongue. Okay, parenteral. Administration of drugs other than through the digestive system is called parenteral because they bypass the GI tract, so that's not where it gets absorbed. Okay, so IV, IM, subcutaneous, all those are examples of parenteral administration. Basic equipment, depends on what you're doing. Okay, needles. So there's two types of needles. We have disposable. Usually that's what we use. We don't really use non-disposable needles anymore, but you know, you go to the jungles in Africa, I've seen them. So. Needle gauge is determined by the diameter of the lumen or opening at the beveled tip. So and give you guys each a syringe to look at.
So y'all reused.
Well, you sterilize it every time. You don't reuse. It's not like reusing a disposable needle. Okay. Look at the package first on here.
You take my meds.
Okay, so this one obviously disposable. Okay, it's plastic. The other ones are like might be a glass syringe, and it has usually what looks like scissors. Needle gauge is determined by the diameter of the lumen or the opening at the bevel tip. So what does it say gauge is on here?
It is
See, it has a G. Where it's the
23
number
G1.
23 gauge. 1, it gives you the length. Okay, so 23 is the gauge. That's the diameter of the needle.
So it's 1 inch?
It is. This one is. Looks like it. So 23 gauge. Usually the higher, not usually, the higher the gauge, it's always like that, the smaller the diameter. Okay? So like a 18 gauge, okay, that's pretty thick. That's like an IV. Like what you give an IV. Probably the ones that they use at Carter Blood Care, I bet they're probably a 16. They would have to be pretty big to stay open and get blood through them for that long.
Good size.
So, yeah, 23 gauge is really, it's about right for it. But it depends on what
do they
kind
use
it
for
is.
shots?
If you're using a really thick medicine, then you might want something like a 22 or something like that. So now insulin syringes, sometimes they're like a 25 gauge. So they're really little, really thin. Okay, so you guys can open these now. So look, ranges from 13 to 31 inch gauge size, lengths between 3/8, and I've actually seen 1/2 inch. Oh, 3/8 is even smaller. 3/8 inch needle is really tiny. It's an insulin, like an insulin needle. And then they can be as long as 2 inches. Depending on, the bigger the person, the longer the needle has to be, because it has to, if you're giving it IM, it has to get through subcutaneous tissue to get to muscle. Okay, so look at, you can take your cap off. Now look at the edge of it. Okay, the bevel, see how the end of the syringe is angled? Okay, that's called, the bevel is like that open area. Usually like if you're starting an IV, you use bevel goes up. You like keep the bevel up so that the sharp end is down towards the skin. Okay, see that opening in there where the medicine goes through? That's called the lumen. And we've heard that word before. That's like any opening, like in your blood vessels, the lumen, that's the inside. The lumen of your small intestine is the inside. Okay, so
why are these like little rubber parts inside the thing like combed up?
I think that helps to express all the medicine out whenever you get to the end.
Oh, so like how would you just measure it like regularly?
Yeah, you just measure the edge of that bevel. It takes all that into account.
Oh,
So the edge of that rubber is just where you would measure. So this is a 3 milliliter syringe. Now, a few things. Well, we'll go over how to use this syringe in a minute, but anyway, that's that. Okay. I just wanted you to see the different parts it was talking about. Okay, needles consist of 5 parts. The point, obviously, you saw that. Talked about the lumen. The shaft of the needle is just the metal portion. The hub is down here where it's actually connected to the syringe itself. And I cannot remember right now what the hilt is. My mind just went blank.
Is it the little squishy part?
No, this is just the needle. Look at.
I was thinking this will take itself.
Let me
You
look.
should, like right here.
I remember
Some
looking this up.
freaky medicine in it. I put one in my forehead.
Like mercury?
Yeah, something like that. I'll put one in my forehead. Put one right
In
here.
your forehead.
We'll go sideways with it.
Probably like that. Okay. These pictures don't have the hilt either.
I think they just crazy. They told you to
I
go.
know.
It's make me want.
Good heroin. Mix with the
No.
heroin.
No,
Okay.
not quite.
You know, crack cocaine or something? So you can get it straight to the bloodstream. Or go back stored in there. It's heroin when they put it in.
Okay, well, I don't know.
Oh, hot. No,
Oh,
methamphetamine,
the
dude.
handle. That doesn't make sense.
Yep. She's like ready. She's got it pulled back and everything. She's ready for it. The girl with methamphetamines. I ain't got a blunt.
Anyway,
You ready?
we'll just keep going. Oh, it's not even on here.
Huh.
They don't know either. Okay,
Hey,
so
crazy.
let's keep going.
I gotta go put that down.
I probably know somewhere in the back of my head. Okay, syringes. Disposable syringes are sterilized, prepackaged. Okay, so this was sterile before you opened it.
Not very sure.
Says non-toxic. They have to be made that way. Non-pyrogenic. Shouldn't cost either. Ready to use. So syringe sizes range from 0.5, okay, all the way up to like 50 milliliters, which would be huge. That would be for like a feeding or something. You know, that's not something that you inject. Now these, usually this is 50 units, so this would be like 0.5. Because there's typically, most insulins are 100 units per milliliter. You can't always decide, but insulin syringes always come in units. They're not measured in milliliters. They're measured in units. So this one's 50 units. But it should be about half a milliliter. And this one is 3. Okay, most frequently used sizes 1, 3, and 5. Pretty common. 10s, use 10 Okay, types of syringes: hypodermic, typically used for intramuscular or subcutaneous injections. Retractable needle cover, used to prevent needle sticks. So a lot of times, I've actually seen some that are retractable themselves. You just hit a button like on the back of them after you're done, and the needle like goes inside the syringe. You also see, and they have a lot of them come with a needle cover, like they'll have a little plastic thing on them, and as soon as you're done, you just put that over the top of it. That way nobody gets, you don't hurt yourself before you make it to the sharps box. A lot of people who take insulin have injector pins, and you just put a new needle in them every day. Yeah. Anyways, and they have medicine, and you like click it to how much medicine they need. Like you click it to 8 units or whatever, and then you give the injection. Like I said, insulin is in units. There's tuberculin syringes, which are teeny little syringes used for small injections made intradermally. Okay, remember when you got your TB? Okay, it just went right under your skin, intradermal. And then pre-filled. Sometimes syringes come pre-filled. They already have something inside of them. Medication containers, ampules. We've looked at those before. Those are those little glass ones. They kind of look like bullets. Small sealed glass containers. They usually have a single dose of medicine. It's not something that you're going to reuse. Okay, you have to use a filtered needle with them, a special type of needle that removes anything that might be left of the glass when you break it. So now, usually the needle that you draw out of something with is not the needle that you inject with, because it loses some of its, it just makes it blunt, makes the needle more blunt the more you put it in the rubber stuff or whatever. So nobody wants to get injected with a needle. Do what?
So you just unscrew it and put a new one in?
Yeah. So I'd get a different, like if I was using an ampule, I would get a filter needle, put my filter needle on here, and pull up the medicine, put my other needle back on here, prime it, and then inject it.
That's pretty nifty.
I didn't know this could all.
Okay, vials. These are small bottles with rubber stoppers. So usually, you just put your needle, clean it, and put your needle in there to get your medication. Some can be used for multiple doses. So here's a good picture. This is a vial. metal cap on the top of it. And this is an
Man,
ampoule.
don't you have some of those in those demo box? Or whatever?
I got some bottles too. When I was, these rubber stoppers, these actually make pretty cute little bottles sometimes. When I was in Ethiopia, we had some people who had to come every single day and get medicine, like for tuberculosis. And so they would like rent a house in this community where the clinic was and stay there for the first 30 days of their treatment. And so every day we would get out, there was like usually around 60 to 70 of them at any given time. So we would get out all of their charts and dose out everybody's medicine, how much they needed for the day, and put it on their chart and then call them in like 10 at a time to come get their medicine. And so what we did with the any extra vials that we had, we would cut off the metal strip around the top, and underneath it had the little rubber stopper. Well, that rubber stopper you could take in and out. It was kind of like a lid. And so we would just clean them really good, and then we would put, that's what we used to dose their medicine, because they would hold, like 5 milliliters or whatever. They would hold like perfect amount of medicine to give, and that's what we'd give them to take for the day. So they would, they'd bring like their bag or whatever, and we'd put their doses of medicine in everything. Right.
So like, what happens if like you don't use all of the medicine?
You throw it out.
Okay.
Now some of it you might can keep for like 24 hours or something, and,
Like if you have 2 shots and they're both.
and you're done. You just throw it away. Put it in your sharps container. Okay, parental medication. Parental, again, injection of liquid substances into the body. Can be liquid or powder. But if it's powder, of course, it has to be reconstituted. And you'll see that word again. You may see it in your notes or whatever. But reconstituted just means you're adding water to it to make it into a solution. Okay. So parenteral routes, we have muscle, intramuscular, intravenous, intradermal or subcutaneous. And then intrathecally is the word for in the spinal column. Intrathecally with a TH. Okay, intradermal injections, again, like when you got your tuberculosis test, just goes right into the skin. Usually has a small wheel if it's done correctly. That's that little bleb, that little white bleb that came up, usually a 3/8 inch or like a 27 or 28 gauge needle is used. Angle of insertion is 15 degrees. You almost give it like parallel. It's almost flat. Usually used at the forearm, upper chest, and back can be used. A lot of times, this is if somebody has an allergy test where they do they give them all sorts of things that might cause allergies. Usually they'll map it out on their back. That's what it's given with one of these. So this kind of shows you the layers of the skin, and it should just go in at the very top layer of the skin. Subcutaneous or sub-Q, you'll see it written out sometimes SUBQ. This is given just below the layer of the skin in the fatty tissue, usually given in the deltoid. Sometimes people will give it back here. You wouldn't give it in the deltoid because that would be in the muscle. But like right behind their arm back here is a pretty popular place. Sides of the legs, and their belly. That's where you usually see people give insulin. Just pull it out and pull out your belly fat and inject it there. And you always try to give it in different areas. Commonly into the abdomen, upper back. Upper back. Anyways. Angle of insertion is 45 degrees, so they're not going to go directly in. It's going to go from the side. Kind of depends on the medicine too. Like it says, insulin, you can give that because that needle is so short and it needs to give it. And then heparin, same way. Amount of drug should not exceed 2 milliliters. Okay, that kind of gives you an idea. Okay, intramuscular injection. IM, so preferred sites are the gluteus, deltoid, and vastus lateralis. We all know that. Thigh, hips, and then the deltoid up here. Used for drugs that require more rapid absorption. So typically the deeper you go, the faster that medicine gets absorbed. Okay, so intradermally, it's going to take some time. Sub-Q is going to take longer than intramuscular. Intramuscular is going to take longer than intravenous. The vastus lateralis is usually used in infants. That's their biggest muscle, and that's why. Okay, their little bottom muscles. I mean, no, their glutes have not. They haven't moved. They haven't. They haven't bore any weight on their legs, so they haven't built those muscles up yet. 90-degree angle dosage may be from 0.5 milliliter all the way up to 5 milliliters. That's the maximum amount that you can get. Infants and children should be given no more than 2 milliliters. The needle typically should be at least an inch, okay, depending on the person, to 3 inches. So that would be really long. I wouldn't think any longer than 3 inches, even for people who are obese, but I feel like it would bend going in or something. It would be so long. But anyway, so depending on how big the person is, that's, you just kind of gauge, how deep you're going to have to get the needle to get into muscle. Recommended gauge ranges are from 20 to 23. Okay, so we're all bit of muscle. Okay, a Z-track intramuscular injection. This is kind of like what it sounds. Okay, this is used when the drug can be really irritating to skin tissue. So you don't want any of that medicine into the subcutaneous tissue or higher. Displaces the upper tissue laterally before you insert the needle. So basically what you do is you pull their skin over to the side. If I'm going to give it here, I pull my skin over, give the injection. When I take the needle out, let the skin go back. Okay? And that makes it, you think about it, if you put that needle all the way through, there's kind of like a gap in there where that needle has been, kind of like a hole. Well, if you pull that over, if you pull the skin over, you give it in the muscle, and then when the skin moves back, it kind of closes it off. Does that make sense?
Oh, okay.
So it's kind of like you put that needle in, then when you move the skin back over, it's like this. So it closes it off, and you don't get so much of that medicine in the skin. Injection sites should not be massaged after the injection. That's because that's going to make it absorb more quickly and going to make it get into that other tissue. Okay, IV. These are used during emergency situations. That's not the only thing. Anyways, rate of absorption and onset are very fast. When we're talking, these are going to work within minutes. Usually inserted into superficial veins, so veins that you can see. Okay, not arteries, intravenous. These are only veins. Pumps, they can provide continuous flow over a certain period of time. So pumps are used, so let's say I want this medicine to go in over 1 hour. I can put that in the pump, and it'll set the rate so that it will go in slow enough that it takes a whole hour for that medicine to go in. That's pretty much what's used these days, unless somebody is just getting fluids and they've got it wide open to get them as many fluids as they can. Topical route, so any body surface, local use, lotions, liniments, ointments, patches. Transdermal are absorbed really slowly. And then drug is carried from the skin by capillaries to get absorbed into capillaries in the skin. Nitroglycerin, that's the word I can think of. I don't know. Estrogen, like we said, hormones, testosterone, nicotine. So like nicotine patch for somebody to help regulate their nicotine so they can decrease it and quit smoking. Inhalation administration, so the act of drawing breath or gas into the lungs. So specifically, the goal is targeted at the lungs themselves or the respiratory tract. So oxygen is one example of this. It's ordered as liters per minute. That's how it's, so like it'll say 2 LPM. That means they're going to get 2 liters of oxygen per minute. That's how it's measured, and you know how much they're getting. 2 is pretty standard. Like if somebody's on oxygen, 2 is pretty much like that's what kind of the initial setting, unless they need more. Medication that utilize inhalers, you have bronchodilators, which do exactly like what they sound. They dilate the bronchi, make them larger, kind of decrease that muscle tone that has caused it to be constricted. Mucolytic agents, which would be what? What does that sound like? Yes, lytic is like destroy or, mucolytic. So like Mucinex is an example of a mucolytic. Helps to break down all those secretions. And then steroids, a lot of times, are given that way too. What do steroids do?
Freeze you up.
Not those kind of steroids. Like medication steroids. They work as anti-inflammatories. Okay, so whenever somebody's getting steroids, think anti-inflammatories to decrease swelling. Okay, now it's going to make them swell in other places, but it's supposed to decrease inflammation in the area wherever that it's, it's in. If we're talking about the respiratory tract, it's going to decrease inflammation in the bronchi. Okay. High concentration of inhaled oxygen in newborn. You have to be really careful in newborns. But anyways, alveolar collapse. Everybody remember what alveoli are? Those little sacs. I know we haven't gotten to the lungs yet, but those are the little sacs in your lungs that actually where gas exchange occurs. They kind of look like grape clusters, and that's where oxygen and carbon dioxide actually move in and out of the bloodstream. Slide in there. Spray and aerosol liquids or fine powders are sprayed in a fine mist. So respiratory treatment for asthma or skin sprays like an inhaler type. One thing, we didn't really talk about inhalers a whole lot, or nebulizers. But inhalers, one thing that they always recommend is to use spacers, and here's why. It's not just for kids, it's for anybody using inhalers. That's because with an inhaler, it's so forceful when it comes out, just the inhaler, that a lot of that medicine just goes to the back of the throat and stays on the back of the throat. It doesn't actually get breathed in. Whereas with a spacer, y'all know what I'm talking about? Y'all ever seen a spacer?
No.
Like a plastic chamber, and you put the inhaler in the end of it, and then it's just like a plastic chamber, and you actually breathe into that chamber. And so you inject the medicine into that chamber, and then you can breathe in like 2 or 3 times and get the medicine that way, instead of it all getting sprayed on the back of your throat and not getting into your lungs. A nebulizer is the machine that you guys were talking about, a breathing machine, and it's just, just sits down and plug a tube into it, mask, and put medicine in the canister, however much you're supposed to have, and then let it go until, usually that, you kind of quit seeing that mist after the medicine's all gone.
And it makes a different sound.
What?
The thing.
Oh, yeah. So, okay. Ophthalmic administration, so eye drops and ointments. Either one of those can be used, must be sterile. Okay, you don't want to just drop some nasty something into your eye. Has to be isotonic. What is that?
Even so, like it doesn't expand or destroy your
Right.
cells.
So, so it needs to have the same like consistency, same like chemical kind of makeup as your eye, so that it doesn't cause burning, irritation. So antibiotics, antivirals, decongestants, artificial tears, all kinds of stuff. Anesthetics can be eye medicine. The way to administer ophthalmic is you don't actually put drops directly on your eyeball. You always pull your eyelid down and you put drops into your bottom eyelid. That's how you administer drops. They'll never touch your eyelid when you get all those germs on there. And then you do your best to keep your eye open and move your eye around before you blink. Because sometimes when you blink, you lose some of that medicine. So keep as much of it in there as you can. But you don't put them directly on your eyes. Okay, otic, which would be what? Odo is
Ear.
ear. Ophthalmos, eye. Otic is ear. Okay, medication instilled into the ear, very low doses usually. And then if someone's eardrum is perforated, they don't get medicine in the ear. It's going to go through it into the middle ear, cause major issues. For adults, up and back, up and out, I guess. For kids, down and back. How you pull their ear too. The same as you do with an otoscope, which you guys will get to do. Nasal, so nasal solutions act locally. Usually that's the reason that we use them. Drops or sprays, commonly used for blocked nasal passages, like if people have a lot of, they're really congested. A lot of times it's those blood vessels that are congested too, and so like Afrin, and some of those are actually constricting, they vasoconstrict. Vaginal route, so local infections can be treated this way, suppositories, tablets, cream, or they can be instilled with an applicator. Rectal medicines, these are helpful. Some antiemetic medicines can be given rectally, like I said, anti-seizure medicines, or for constipation, like an enema is obviously considered a rectal route, or a suppository that has, to make someone have a bowel movement.
It looked like he had a glove on.
Yes, he has a glove on. It doesn't look like that, but it does on here.
Okay.
You definitely want to wear gloves.
I was like,
Implants, insertion of medication by surgery under the skin. There are some implanted medicines. I know there's definitely a birth control that can be implanted. Medication releases really slowly and just constantly secretes it. Okay, and that is that. I would like for you guys to, on the back of the page the other page that talked about routes of administration. I have another page up there.
I'm not where I said it has this interracial.
There's like a chart. The one that's.
First thing we did. I would say.
I gave you an extra thing in notes that looks like.
Oh,
It says routes of administration at the top. Looks like this.
Yeah.
If you go, you can tear off the back page of that. I think the back couple pages. I want you guys to do that that little chart in there.
Okay.
And you can use this to fill it out too.
I'm done. Let me go ahead.